The annual incidence or occurrence rate is between 63 to 107 per 100,000 women versus men. It occurs most in people aged 50 to 54 years old. The risk factors include heavy manual labor requiring lifting of at least 25 pounds, smoking, driving large trucks, operating vibration equipment, as well as a previous neck and/or back pain injury. 15% of people with this condition reported some type of trauma or exerting physical force. The most common level of injury is C7 or cervical number 7, although any of the cervical nerve roots can be affected. In one study based on Mayo Clinics, they found 69% had C7 damage versus 20% in C6. The C stands for cervical, cervical meaning neck. Stay tuned to learn more about this condition and ways to prevent it.
Welcome to Region Med 101 podcast with Dr. Yu. Learn about all things medicine, health, and wellness. We hope you enjoy listening. Please show your support by subscribing and follow our podcast.
Cervical radiculopathy, cervical neck radiculopathy, commonly referred to as a pinched nerve in the neck. This results in radiating and traveling pain that can sometimes lead to weakness, numbness, and wasting of the muscles. In cervical radiculopathy, the nerve root coming out of the spinal cord is either irritated, compressed, or damaged. The causes of cervical radiculopathy include rare issues like compression from nerve tumors like schwannomas or neurofibromas, or other common issues like compression from a herniated disc, trauma, or arthritis in certain areas of the neck. Men are more affected than women, almost a 2-to-1 ratio. And studies have shown 50 to 40-year-old males who work in heavy labor, that smoke, and operate heavy machinery are affected. There are 7 cervical neck vertebrae. These are the small bones forming your backbone and serve a lot of functions, one main one being protection of your spinal cord and nerve roots. There was a study done at Mayo Clinic, and it found that the most common cervical neck level that was injured was C7. The next most common cervical neck injury was C6. Why is radiculopathy important? The direct compression of these nerve roots can cause interruption of blood flow, interruption of nerve signals, such as conduction block. Volume of intervertebral foramen increases in flexion, but decreases in extension. How does cervical radiculopathy present itself? Let's break it down to new or acute onset versus long-term or chronic. In the new acute onset, this is usually due to direct mechanical compression of the nerve root, and young people are the ones that generally come to physician clinics. Complaints are usually neck pain with radiating and traveling pain, numbness and weakness down the arm. The longer-term chronic cases are usually caused by a condition called spondylosis. This word describes a condition where there is a narrowing where the nerves exit out of the spine. Bone spurs over time can cause similar issues. Usually, people that come to physician clinics are middle-aged and elderly patients. Again, complaints are neck pain, radiating and traveling pain, numbness, and weakness down the arm. Imaging. Depending on the cause and clinical findings, a simple neck x-ray, AP and lateral, oblique, flexion extension films may be done. Please note that flexion extension films are not done if a high-velocity trauma is suspected. So x-rays are good to check for fractures, arthritis, and other bony abnormalities. If there is a question of herniations or spinal canal stenosis or narrowing, an MRI may be ordered. This is the image of choice, especially if signs and symptoms have occurred for more than 4 to 6 weeks, or if there are red flags based on examination. If there are signs of myelopathy or spinal cord injury, this may indicate a neurosurgical emergency. If tumors are suspected, contrast studies may be useful. Physician examinations should focus on dermatomal, myotomal levels of injury. Evaluate for symptoms of myelopathy like loss of hand strength, balance problems, bowel and bladder issues, and sensory and motor deficits, reflexes, as well as upper motor neuron and lower motor neuron exam. Although uncommon, if a child or young person presents with these symptoms, physicians should keep spinal cord tumors like ependymoma and leptomeningeal metastasis, as well as inflammatory and infectious causes like Lyme disease or trauma on their differential. Lab studies are not routine and regularly done. but if clinicians are worried about infections or inflammatory diseases, CBC, ESR, CRP may be indicated. As a trained physical medicine rehabilitation and an anesthesia-trained pain physician, we can sometimes do what's called a neuroconductive study or EMG test, electrodiagnostic tests for short. This will help localize and map out what nerves are injured. This test usually is made up of two parts. First part is the NCS, or neuroconductive study, which uses electrical signals to test nerves. The second part is the EMG test, or electromyography test, where a needle is inserted and checks the activity of the muscles. These tests are important, especially if surgery is recommended. One thing to note, physicians have to wait at least 10 to 14 days after an injury or after symptoms present itself before this test can be done. Of note, this will be explained in a different episode on Regen Med 101. So how does the outcome or the end results turn out for patients? 90% of patients do improve with medical and rehabilitation treatment. If pain persists or worsens, further medical treatment and possibly surgery may be necessary. If you or somebody you know has suffered from cervical radiculopathy, please seek out proper medical care. How to prevent cervical radiculopathy from occurring? Knowing the risk factors like heavy lifting or neck trauma from sports like football, heading soccer balls, flipping during gymnastics, car accidents, smoking, all these increase the risk for cervical neck radiculopathy. Having a good sleep posture, good support pillow, good sleeping habits, good stress levels, and the way you walk or even sit at a desk, which is also called ergonomic postures, all these are paramount in preventing and treating active cervical radiculopathy issues. What are the goals of doctors and physicians? It is to relieve pain and improve the patient's function to baseline and prevent recurrences and relapses. Depending on the severity and seriousness of the issues, most patients are generally treated first with NSAIDs, muscle relaxants, physical therapy, activities and exercises. As the condition becomes more serious, a certified pain physician can offer epidural injections or nerve injections to help manage the pain. Sometimes even new technologies like spinal cord stimulators and even implantable devices can be done. If the condition becomes very serious or very severe, neurosurgical procedure may be necessary. The mechanism of action for epidural corticosteroid injection, this is an anti-inflammatory response from an inhibition of phospholipase A2, which initiates the arachidonic acid cascade. It also includes blocking nociceptive C fiber transmission, hyperpolarizing spinal neurons, and inhibiting ectopic impulses by stabilizing nerve membranes. Two routes are administered, interlaminar and transforaminal. So you've learned about what cervical radiculopathy is, how it presents, the types of treatment options, and the ways to prevent it. This completes our podcast on cervical neck radiculopathy. Until the next episode. Knowledge is power, and it is the first step in knowing your condition, disease, or injury.
If you enjoyed listening to our podcast, please visit our Instagram, Twitter, and Facebook. For more detailed information, please visit our website at regionmed101.com.
This podcast is made for the general education to the public and is not intended to substitute for or provide medical advice. All information, content, and material from Dr. Yu and his guests on Regen Med 101 is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician. Please see podcast and page content for full disclaimer. If you have a medical emergency, call your doctor or 911 immediately.